On November 5th, we will be hosting a Honoring the Heartbeat Mental Health and Wellness Powwow. It will be at the Potawatomi Hotel and Casino, the Woodland Dreams Ballroom. And so this is something we've been planning. We want to make sure that it is inviting and welcoming, but at the same time, safe, particularly during this pandemic. We want to be able to assure that not only will people have the welcoming of a powwow, but also we'll be looking at offering a meal during this event. We have a featured performance speaker, James Jones, the Notorious Cree, will be present, and we will have that followed by a 7 o'clock color guard and closing at 10:15. So one of the things that we wanted to make sure is that this will be a safe event. We will be doing several things to assure that all members who attend will have this have the feeling of safety and prevention here. So we do ask that all participants have one of the following. So one is proof of vaccination, and two, or I should say proof of vaccination or proof of a negative COVID test 72 hours prior to the event. Our clinic will be providing free testing. We'll be providing free testing, so that will suffice. If you bring that and it is negative, we will certainly honor that. We just want to make sure that we can have this gathering and make sure that it is safe for everyone participating. Mask will be part of the event as well, so it is certainly looking to be quite the event already, since we've had many requests and already scheduling people right now to get the COVID test. So please, please look for the date, and it is November 5th. It is a Friday. I know this says November 6th, but it is November 5th. Jeremiah, is that right?
Yeah, so actually, sorry, the flyer that you're showing right there, that's for an event that we're having on Saturday following the powwow. So there'll be a suicide talking circle at our clinic on Saturday the 6th, but the event, the powwow itself, is November 5th.
Got it. November 5th is the powwow. November 6th is our talking circle that we'll be hosting at our health center from 10 to 11:30. So with that, I hope to see you there. I anticipate this to be a very positive event and safe for everyone in attendance, and also have some great entertainment and food. So please put this on your calendar and look forward to seeing you next Friday at the casino. All right. So the last time we talked 2 weeks ago, there have been a lot of things that have occurred over the last couple of weeks. So what I'd like to do is try to summarize the results of all of these events. So as I mentioned before, October 14th, FDA met regarding boosters for Moderna. October 15th, FDA met for boosters for Johnson & Johnson. On October 22nd, the CDC approved Moderna and J&J, as well as allowing people to mix and match shots. So I've attached the hyperlinks to that for people who want to read more about this. And on October 26th, the FDA met to discuss Pfizer's request for authorization for COVID-19 for 5 to 11, and the panel recommended that to proceed forward. CDC is going to follow up and provide its ultimate final guidelines, but we pretty much know what that is going to look like. So what I've done is try to condense this into at least an informative slide. So much has happened, and it's getting more and more complex. But I try to summarize this for everyone. So if we look at Pfizer and Moderna, if we look at it side by side, obviously Pfizer has been approved for as a primary series for 2 doses, as well as Moderna. Now, the boosters are a little different, but essentially the same. So a single Pfizer dose, the same dose that was originally given, will be the same, and the requirements are at least 6 months after your series has been completed. Now, intermixed in this is a 3rd primary series dose for individuals 12 years of age and older who have been determined to have certain kinds of immunocompromised health conditions. And mainly these are individuals with severe, maybe perhaps transplants, hematological cancers, who've undergone chemotherapy or under high dose immunosuppressive medications. So I'll get into a little bit more about that in a bit here, but I wanted to introduce this profile under Pfizer. The same is true for Moderna. The age differences are a little different. Pfizer is 12 years of age and older. For Moderna, it is 18 years of age and older. So now what was approved of this framework is a single dose booster to be given to individuals for Pfizer. These are the criteria: 65 years of age and older, regardless of any underlying health condition. 65 and older are eligible for a booster for Pfizer. 18 to 64 years of age at high risk of severe COVID-19. 18 through 64 of age with frequent institutional occupational exposure to COVID. So a single booster dose to be eligible, who have completed primary vaccination with a different authorized vaccination. So this is where that mix and match now comes in. So we have approval for primary series 12 and older. We have a 3rd dosing for 12 years of age and older for immunocompromised individuals, and then a booster for 65 and older, 18 to 64, high risk, frequent institutional occupational, and the last one being a booster, mix and match boosters. So from Pfizer to Moderna, Pfizer to Johnson & Johnson, and vice versa. That combination is now an option. So under Moderna, on the right-hand side, essentially the same. Obviously, the ages are a little different. Now, the booster that was approved is the 0.25 millimeter. Now, this is 1/2 the original dose of Moderna that was given to individuals who got this series. Obviously, the age groups are different, but essentially everything is the same. The boosters are eligible, again, 65 and older, 18 to 64 for high risk institutional occupational exposure to COVID. And then the booster you can mix and match. So Moderna with Pfizer, Moderna with J&J. And the last one, a single dose Janssen COVID vaccine booster may be administered at least 2 months after the primary vaccination with Janssen vaccine to ages 18 and older. So really no requirements, eligibility requirements for Johnson & Johnson. And so other than just having a single dose, now you're eligible to get the 2nd dose. So this is a lot of information, and this is how things are starting to pan out. So these are the current recommendations and the eligibilities for individuals. Now, I had mentioned individuals at high risk with underlying health conditions. You know, we've talked about this before. What does that look like? So individuals with obviously cancers, cardiovascular disease, kidney disease, lung disease, diabetes, cardiovascular disease, smokers, both not only current, but also former smokers, obesity, children with underlying conditions, liver disease, Down, HIV, pulmonary idiopathic pulmonary fibrosis, pulmonary hypertension, so, and all other categories, asthma and hypertension. These are fairly common underlying health conditions and have been shown to be put people at higher risk for severe disease or complications. So these are your underlying conditions. As far as occupational qualifiers, first responders, healthcare workers, firefighters, police, educators, food and agriculture, manufacturing, correction workers, U.S. Postal Service, public transit, grocery store workers. So these are all very important. These are certainly occupations that put people at higher risk, essentially as direct contact with other individuals. So this probably takes care of probably close to half of the country, both with underlying conditions and occupation. It is a lot of people. It is a lot of people, and well over 50 million individuals automatically qualify. Now, for individuals, what's not listed here, let's say you are 50 years old, and let's say you have no underlying health conditions, and let's say you work for a corporation that allows you to work telehealth at home. Well, you don't really qualify under these criteria as an occupation or with underlying health conditions, and you don't meet the age group. So now that's the current recommendations. I'm sure if you could probably find somewhere that would provide a booster, but the general guidelines, the recommendations are for high-risk individuals. Younger people with no health problems who don't fit these occupation exposures, their risk for not only COVID, but severe or complications are really on the low side of risk here. So this is quite dynamic now for eligibility criteria, recommendations, and guidelines. And I'm sure it is going to get more well-defined as we move forward. But this is where we are right now. Now, I do want to bring up a few things that the CDC has presented, especially when it comes to kids, because that's probably the big issue right now. And essentially, CDC came out that kids aren't spared from the harm of COVID. We know this. We've seen this, the infections of kids less than 18 years of age certainly are part of this equation. They weren't so much maybe 6 months ago, but they are definitely on the forefront of all discussions right now. So just to give you some background and some insight into this, so almost 2 million individuals, 5 to 11, have been infected with COVID during this pandemic. Now, what's of particular interest right now is during Delta. And Delta, we're talking essentially from July to present, there was a sharp increase, especially in the 5 to 11-year-olds, representing about 10.6% of cases as of the week of October 10th. So this is pretty significant since this age group population only represents about 9% of the total population, and they were representing 10.6% of all infections. So that is pretty significant. when it comes to observing and counting which age groups are getting infected. Now, what's also interesting is that the CDC is coming forward that 42% of kids age 5 to 11 years have antibodies from natural immunity. Now, looking at this, you would say, well, kids could get it, but they're only being 42% are only demonstrating that natural immunity with their antibodies, which means they could get reinfected with this. So this is an important point, because when we look at prevention, if only less than half of the kids are actually showing natural immunity, there will be a need to consider kids getting the vaccination, at least in a strong recommended fashion. So that is something that is going to come forward. That is something that is going to come to the headlines, national headlines, as to vaccination for young kids, and how do we proceed forward? Is this something that we're going to be looking at mandating as well? This is going to be a pretty big question that's going to need to be answered. And if people thought the mandate vaccines for employment are a big deal now, it certainly will be if that ever comes to fruition, for mandating kids less than 18 years of age. Now, hospitalization. So we see that there's been a lot of infections for young people, young kids. Is that necessarily translating into something of a negative nature? And there has been hospitalizations, a little over 8,300 hospitalizations for 5 to 11. Now, this is in stark comparison to, young adults, 18 years of age and older. This pales in comparison to what has gone on nationally and throughout the world. Now, the CDC's come out and basically said that about 30% of kids 5 to 11 have been hospitalized that did not have underlying conditions. Now, this would be essentially taking all of healthy young kids with no health problems. About 2,500 individuals have been hospitalized. That's through the entire pandemic. That's not a whole lot. Now, if you flip this and say, okay, well, 70% of all kids hospitalized between the ages of 5 to 11 had at least one underlying health condition. Now, what the CDC doesn't come out and say is what that one underlying health condition is. Is it asthma? Is it individuals who are immunocompromised, other neurologic development disorders? These granular details are important, I feel, in help guiding parents when it comes to deciding vaccinations for not only themselves, but also for their kids. So, but if we take this 70% of all hospitalizations, that's 5,800 cases of the 8,300. Now, again, this is a very small number when it comes to comparing hospitalizations, but it's important to realize that if your child has an underlying health condition, it will put them at risk for not only hospitalization, but also perhaps fatality. And this is important to know, because this is a group of individuals that you definitely want to look at getting vaccinated. So that's kind of the latest information that the CDC has at least written and wanted to convey to the public what is going on with kids 5 to 11. Some other important outcomes. Now, MIS-C, This isn't something that is getting much attention, but it is a condition that is the result of being infected with COVID. It is called multi-system inflammatory syndrome in children, MIS-C. And what is noted is that it is the highest, this disorder is the highest among kids 5 to 11. Now, what's interesting about this is that this inflammation, we know about COVID causing an acute, a very intense inflammatory response. Our bodies respond in that way, and it's not particular to just one thing, it is total body. So what happens is there's an inflammation reaction that occurs that can involve the heart, the lungs, the kidneys, the brain, skin, eyes, and even the GI tract, the stomach. Now, there's been a little over 5,200 of these cases have been reported as of October 4th. And about 60 to 70% of these kids are admitted to the ICU, and up to estimated 1 to 2% have actually died from this disorder. Now, what's a little peculiar about this is it's not get COVID and you get this disorder right away. It could be up to 2 to 4 weeks after getting COVID, actually recovering from it, where you can actually develop these. So it is something that's to be watched for, and for the most part, it is a lot of supportive effort in getting kids over this acute response, inflammatory response to the body. Like I said, the vast majority do recover. Some do require hospitalizations, and the ones that do get admitted to the ICU do require more intensive effort and support. But for the vast majority of individuals, of kids that do get this, will recover and do just fine. So as far as fatalities, for kids 5 to 11, 94 cases, individuals have been identified who passed from COVID. Now, CDC wanted to make a point here that COVID deaths place us at the 8th leading cause of death for this age group. And most recently, because of Delta, with the increased surge in numbers, it has gone from 8th leading cause to the 6th leading cause. So this is part of this risk stratification that every parent and couple of kids will have to take into consideration when it comes to vaccination for their children. So now, just like adults who've experienced the long haul symptoms of COVID-19, this follows very similar for kids as well. They deal with fatigue, headache, insomnia, trouble concentrating, what people have called the brain fog, muscle and joint, and a chronic cough. These are very similar to what adults get, again, but it is a small percentage of individuals who do get these symptoms. So these are kind of the new issues that are coming up because the vaccine has been approved for 5 to 11. The shift in different age groups, now we need to look and assure that information is out to everyone, understanding what is going on. Now, what I was able to find, and again, this is still really important, how does this impact the Native population? What is MIS-C? How does this impact the Native population? Well, the CDC has been able to publish information of race and ethnicity of cases. And as you can see, the vast majority of cases occur in Blacks, non-Hispanic whites, and Hispanics. So, and then on the far right side, I kind of underlined here, the native population is really, really, really low. I mean, probably 1% of all MIS-C cases have occurred in the native population, which is incredibly small. But again, I'm here to present this information so people can be informed and really understand the impact of what COVID can have on your family. Now, I mentioned before, immunocompromised individuals have been approved for a third dose. Okay. Now, what's interesting here is that a fourth dose is creeping into the discussion here. And what's kind of interesting here is the primary series, the 2-dose series of Pfizer and Moderna. It's been shown that individuals who are immunocompromised don't mount a very strong protected immune response. That is why a third dose was actually recommended for these individuals. Now, what's interesting here, now that third dose can certainly bump people up, and that's what you want to see. But a fourth dose is now actually being introduced and being projected to be part of a regimen for the immunocompromised individuals. Because now they're saying the third dose is kind of part of that original series, but because the third dose, you do have waning immunity over time, they're considering the fourth dose now as the booster. So this is going to be coming forth. This is something that's going to be openly discussed. There are individuals in this country that would benefit from a fourth dose. Now, a fourth dose for immunocompromised, that's about 2.7% of the US population. Like I mentioned here, organ transplant recipients, certain cancers, people with HIV. So these are, the strong indicators of underlying disease of people that will need that fourth dose. This is what, 2.7%. That's about 11 million people that are represent here in the United States. So, so does that mean a fourth dose for everyone else? Not likely, but that fourth dose, if you're looking at a booster can come in the form of a fourth dose. Maybe it's your third dose, but this third or fourth dose maybe end up being more like your annual vaccine to COVID. That's how this is going to get morphed into, much like how we do annual flu shots. We may be heading towards an annual COVID for the foreseeable future. So that's on the horizon. Fourth dose, third dose, fourth dose, annual vaccines could for COVID is certainly not out of the realm of thought here. Now, as far as what's going on globally and here in the United States. So on the left-hand side, we have global trends. As you can see, the red bar graph here showing the increase in the waves, one wave, third wave of infection. As of the last week, at least globally, there has been a slight bump up. Now, does that necessarily mean every country is trending upwards? No. There are some countries that are increasing, like the UK, which may be driving this number up, because it's certainly not the United States that's driving this number up. So, but looking at the United States, you see that the trend over the last 6 weeks has been steadily declining. And that's good. The fatalities as a result of this, and this last surge being primarily the Delta variant, we see that the number of fatalities are going down. And the green bars indicate the trend in weekly vaccines being administered. So you can see here in the United States, it is pretty much plateaued and has not made any significant changes. Now, to get a little more in depth of what's going on here in the United States, on the far right-hand side, you see the states. This is the 7-day weekly average of cases that are ongoing. We see Texas, California, Pennsylvania, Michigan as being the top states in the country that are leading with COVID. We see Minnesota that's in the mix here, but as you start going down, we see Wisconsin is still up in this top tier, but it is starting to recede. Florida used to be the #1 in the country, is now dropped down, and I will see that I see that as a trend that will continue here unless something dramatically happens. But overall, all states numbers are trending downwards. Some are layering up, and some are trending down, like Wisconsin is. So again, with the trend going down, admissions to the hospital are also going down as well. There's been 11% decrease from the week prior, and looking at from what's happened from January to January, I'm sorry, from January to now, there's been almost a 67% decrease in hospitalizations for newly confirmed COVID. So, you know, this is a good sign that things are starting to get back to at least the level back in April and May. So the trends are getting better. Admissions are going down. COVID infections are going down nationwide. Now, I wanted to bring this up that our facility has been preparing and fully capable of providing boosters for individuals. For Moderna, we're offering second doses as well as boosters on Tuesday, November 2nd from 1 to 4. Please feel free to call us to do that, but we are offering this as a final clinic. As far as boosters from here on out, please call, set up a date and time. We can provide that for you at any time. Same with Pfizer. We are providing boosters as well. And as far as eligibility, as I mentioned early on in this presentation, and you may want to check the CDC site for that as well. But we are offering, we've been prepared. We certainly have been able to accommodate a lot of people who are requesting boosters at this time for both Moderna and Pfizer. We do not have Johnson & Johnson here, but given the fact that people can mix and match, we have plenty of Pfizer and booster available for anyone. Now, I wanted to bring this slide up, looking at Milwaukee County and the race and ethnicity populations here that reside here. As you can see, the far left side, and I wanted to bring this and highlight it because it's an important point. The Native population here in Milwaukee County has now reached a level of either first dose or completion at an extremely high level, and a population that looks to appear to be the highest ethnicity group in Milwaukee to be vaccinated. So this is a tremendous accomplishment, and I think the messaging to get vaccinated has definitely impacted the Indian community here to follow through, and the Native population is the highest vaccinated population here in Milwaukee County. So that is great news. just to bring this back to the kids, you know, the trend in Milwaukee County for cases is going down for not only adults, but also in children, 18 and younger, the trend is going down. Hospitalizations are going down as well, and the number of fatalities are starting to recede as well. So these are all good markers, not just what's going on nationally, but what's going on here in Milwaukee County. So this is important to really understand that going into the cold and flu season, that our numbers are going down. Vaccination rates have essentially plateaued. They're not budging much, and the amount of new vaccines that are being administered as a first-time series have really slowed down. Now, the flip side of this is now people are starting to look at getting boosters, and boosters are starting to outpace the initial vaccination series. So this is something that's going to be highlighted probably in the next couple of weeks, that we're probably going to be seeing a lot more people getting boosters than primary series. So one new thing that has come out is what's occurring here in the month of September, the cases here in the state of Wisconsin. So when you look at this slide, you go from left to right with the addition of September at the bottom. The rate of people who have completed their series of vaccination, 52.2%. It's a 2.3% increase from the month prior. But when we start looking at cases to fully vaccinated versus unvaccinated individuals, the age-adjusted rate, so age-adjusted, that basically takes all individuals, regardless of age, and you weight it based on the rate per age group. We have a rate of 513 cases per 100,000 versus the unvaccinated rate of almost 2,400. That's 4.5 times greater rate in the unvaccinated compared to the vaccinated. So based on this information, without a doubt, pretty straightforward how the vaccines are protecting individuals, 4.5 times greater. So now, if we look at age groups, we see that on the left-hand side, the rate of vaccination, age groups who've completed the vaccination, we see that the younger population has increased the number of individuals far greater than all other age groups. So 12 to 15, there's been an 8% increase from 2 weeks ago. From a month ago. And 16 to 17, a 4% increase from a month ago. So there's a great deal of individuals that are being vaccinated in that younger population. And then all the other groups have increased, but at a much smaller rate. As far as rates of infection for fully vaccinated versus unvaccinated individuals, every age group has increased, whether you're vaccinated or unvaccinated, but that the rate of increase has been much smaller. The rate of increase per 100,000 has been much smaller than the unvaccinated. You can see here that I listed the total number of 600 cases per 100,000 increased by 170, whereas the unvaccinated's gone up to almost 2,300 cases per 100,000. That's a 900 case rate increase since last month. And you can see the age-adjusted rates. Obviously, there's a big difference as well, with the unvaccinated making up a big portion of that increase. Nearly 58% of the U.S. population has been fully vaccinated, with 69% of 18 years of age and older, 85% of 65 and older. This is really looking at just the trend of what the vaccine has been occurring. And you can see to the far right that trend has markedly decreased and has continued to do so over the last too much. So a particular instance of what's going on in the Native communities of the region, Michigan, Minnesota, Wisconsin. We see that Michigan, 6,400 total cases to date, 345 over the last 2 weeks, 173 cases on the average per week for the last 2 weeks. Minnesota has excelled in the number of cases, a little over 9,100, almost 600 new cases, 290 cases on the average for the last 2 weeks, and 8,700 cases here in Wisconsin, 369 new cases from 2 weeks ago. As you start looking at how does this compare from one state to the other, we see that Michigan and Wisconsin's rates are starting to plateau. Minnesota started at a much higher level and they are starting to decrease. So Native communities in the state of Minnesota have certainly been impacted at a much greater rate than the other 2 states. And hopefully this trend will continue for all 3 Native communities of each respective state. So I know we started late and I want to try to finish on time relatively. So as far as what's going on here in the state, second in case rates, second in hospitalizations hasn't changed. And as far as fatalities, Natives still have that highest rate in the state of Wisconsin. Taking this back to the kids less than 18 years of age and older. Natives are now have the highest rate in the state. And I think what's of particular interest over the last couple months, as I mentioned, a lot of the case rates have been occurring in the younger population. We start looking at race and ethnicity as a breakout as to where all these cases are coming from. We see that this orange line, the orange line represents the Native American population here in Wisconsin, and we see that they have maintained a very high rate, a higher rate than all other ethnicities, which is a bit concerning. Now, does this necessarily translate cases to hospitalization? And the answer is no. Even though we may have the highest case rate amongst our Native youth, it is not translating in hospitalizations. So kids are definitely contracting, getting sick, but it's not leading to hospitalizations. And as a result, has not led to fatalities. So as far as what's going on here overall in the state of Wisconsin, these are data tables that I've created over the last 18 months. I've been updating this, how the trends have been going. The top half represents 2 weeks ago. The bottom half represents what has been the last 2 weeks. And essentially the same trend has been occurring. Overall, the numbers are decreasing. And when you look at this a little more closely, we see the age group of 10 to 19, almost 4,700 cases. That is the highest leading age group, followed by 30 to 39. Those are the 2 age groups that have had the highest number of cases. Now, when we look at, as I mentioned, high rates of cases in our youth and young people, 10 to 19 has the highest impact, with the highest rate of infection, as well as 0 to 9 with 12%. That's 29, almost 30% of all new infections are occurring in people less than the age of 20. Now, if you flip this, does this necessarily mean more hospitalizations? And the answer is no. The trend goes in the opposite direction, where the individuals that do get infected less than the age of 20, they have the lowest rate of hospitalization, and with the highest being in the older age group. So this is a trend that's been going on. The rates have been essentially the same, no significant change. So with this, new development with the approvals that are going to happen for Pfizer vaccination 5 to 11. Again, this is something that families are going to need to decide for their children to get vaccinated. So, Jeremiah, I'm going to turn this back over to you, and if there's any questions, I'll certainly open to addressing those.
Yeah, I just, a quick one, maybe a quick two, I guess. Thanksgiving is kind of coming up around the corner with, 5 to 11-year-olds probably, going to be able to get a dose in there, maybe 2 doses in before Thanksgiving. What are you telling your patients? What are you telling maybe your family of, how that's going to look, how this year's Thanksgiving is going to look compared to, maybe last year's or the year before?
Yeah, so, the dynamic is certainly a lot different this year than last year. Last year, no one was vaccinated. Vaccines weren't even out. And so this year, that rate of vaccination obviously is much higher. Families interacting, everyone, at least the vast majority of people are now vaccinated. Kids 5 to 11, there's going to be some more liberties to be taken this Thanksgiving than last year's for sure. And I think as obviously we all have our children's best interest at heart. And I think it's important that every single person look to this new development of Pfizer being given approval for 5 to 11 vaccines. I think families need to really consider this as an opportunity, especially if you have a little one that has an underlying health condition. I think without a doubt, this will be absolutely key and essential that your child be vaccinated. And again, this falls into this whole household of prevention and protection. Not only may you and your spouse may be vaccinated, but given Thanksgiving, holiday season is coming, family get-togethers, it's going to be important to minimize and reduce that risk of transmission within families as a result of all of these get-togethers. That you think long and hard about getting your kids vaccinated for this upcoming year.
Just a follow up on that one. So obviously right now, it's the 5 to 11-year-olds. The past one was, 12 and above, 12 to 18-year-olds. Right now, the, 4 and younger are kind of sitting in limbo, of course. And so, if you're let's say you're a family, you got a 6-year-old and you got a 4-year-old, are you treating, the two of them differently, not any differently than you normally would, I guess, but just in a sense of precautions and what you're doing around the house, or, little John who's 6 doesn't have to wear a mask, and, Sam who's 4 has to wear a mask, and, or, stuff like that. How are you, is there a difference? Are you treating them differently, or is it just a wash?
I mean, at the end of the day, it really is how you look at the family as a whole, as an entire entity, as a unit, and really look at stratifying risk within that home. Obviously, parents and grandparents within the household that are vaccinated obviously provide the highest level of protection. But we know that even individuals who have, even young individuals that have had COVID, don't necessarily mean that's going to be transmittable throughout the house. The risk is up, it's not zero. And obviously being vaccinated provides you a much higher level of protection. But when it comes to, your kids kind of borderline, either a year younger or a year older, you really should take each and every one and view them collectively as a whole, as opposed to isolating and singling out based on age.
All right. Thank you, Dr. Nace. And I guess with that, we'll leave you with the last word. And I guess, yeah, let us know what we can expect, next Friday for those of us showing up.
Yep. So again, I want to mention this follow-up. It is our Honoring the Heartbeat Mental Health and Wellness Powwow, November 5th at Forest County Potawatomi Hotel and Casino here in Milwaukee, 5 to 10:30. We are asking for a safe event for everyone. We are asking to show proof of vaccination as well as a negative, proof of vaccination, or if you're not vaccinated, proof of a negative COVID test 72 hours before the event. Our clinic is hosting and we are providing free testing for individuals the Tuesday and Thursday before this event. So next week, Tuesday, next week, Thursday, we will be providing free COVID testing for all people who want to attend this event. I highly recommend it. This certainly may be a good way of demonstrating, not just for safety and prevention for this particular event, but I think this is something that could be considered for other regions and other tribes to consider as a model of how to provide safe and effective ways of preventing transmission of COVID in honor of our culture and traditions. And so if you are interested, please feel free. If you're vaccinated, just show proof of vaccination. You'll be good to go. If you can't get a test, proof of negative testing here at our site, feel free to get them anywhere as long as you show up with that negative result. It is sure to be a lot of fun. So again, a lot of information has come out, a lot of new stuff that I presented. I will continue to provide this as I feel it is a benefit for a Native community to understand what the impact is to us as a Native culture and community. So until next time, everyone, stay strong. Take care.